about the fight of sickle cell and what we are doing as a people and what we must need to do as a people to fight this disease that is harming specifically a lot more blacks than anyone else. Miosha, please, we people have known you before. It was on my show, and Derek, people have known you. If they haven't, that's their fault for not watching my shows. Shame on them. And if they don't know that I'm a board member of the American Red Cross, shame on them. But let's talk about sickle cell because I really want to get into the specifics of why we needing the blood so much. And we are in desperate, desperate cry need.
Absolutely. So, one of the primary reasons there's a huge push and a huge call to action within the Black and the African American community is because, like you mentioned, sickle cell disease, though it impacts a variety of ethnicities here in the United States, it disproportionately impacts Black and African Americans. In fact, out of the 100,000 cases that we continue to fight on a daily basis, over 90% of those patients are Black or African American. And the push and the need for blood from the Black community is essential because, like any other aspect of our DNA, there are certain properties specific to blood that you'll find among certain populations, among certain groups. Yes, blood is blood. People ask me that all the time. They're saying, well, are you saying all of our blood is not the same? Well, hey, all of our DNA coding is not the same either. And blood is the same way. I can't give a patient that's A positive B negative blood.
And that's something people
Blood is
got.
blood, right?
Yeah,
But
right.
those characteristics matter, and the characteristics that are critical for patients living with and battling sickle cell are going to be the antigen negative big C, big E, and big K, which you can only find in the Black and the African American community in the combination that's required for optimal treatment for patients with sickle cell disease.
And so, So explain that difference. You hit it on a little bit, but when we talk about the antigens that's in the blood, and blood isn't just blood, and why we need African American blood, we need a lot more people, minorities, to donate because it's very specific when the blood's given to people with sickle cell disease.
Exactly. And that's part of the matching that we do. And I have spent several hours in our immunohematology reference lab. We call it the IRL. I see the orders come over probably on an hourly basis from our hospital partners that are requiring not just a certain blood type, but very specific antigens. And there's over 600 antigens in blood. And out of that, there's some aspects that are only found in the Black and the African American, as well as the Latino population. So we need that blood in the blood pool so that we can better provide those units of blood, so that we can give a more properly matched version of that unit versus our general universal blood type. That's just going to lead to further complications, and that's not what we want to do. Providing 40% of the nation's blood, we have made it our business and our personal commitment to triple our African American and Black donor base so that we can have the pipeline required to make sure those blood products are always available. And we can't expect someone to fill the rear for us or step in, because that's impossible. The products that we need must come from communities of color, namely Black and African Americans, because only we can really provide the very type specific product that's required for the patient.
Now we know that the American Red Cross is we provide. It's not we, and the people understand when I say me when we talk about Bridges Live, because I sit on one of the boards of the American Red Cross here in Montgomery, Frederick, and Howard County, and we are dangerously low, and we try to have these blood drives, and we'll talk about the blood drives later. But how low are we really?
We're dangerously low. We don't have enough blood to properly fill the orders. And I can't really quantify that in numbers because it's a national emergency. But I know here locally, we've got a few hundred patients that we're treating, and Majority of those patients are being treated out of the Johns Hopkins healthcare system. So there's a constant need because some patients require a full exchange, and that's going to be, let's fuse out, the 7 or 8 pints that might be causing the complications. The blood starts to sickle and the hemoglobin can't properly support your organs and your tissue. So when you have a full exchange transfusion, that might take up to 7 or 8 pints of blood. And it all really should be of the same blood type and the specifics to the blood. So when you have patients requiring multiple units, throughout their course of treatment, it's imperative that we keep that blood going because the blood supply should match the population.
And it does.
We should contribute in such a way that we know, even if you don't need it, I don't need it, we know that there's somebody walking with our same blood journey, our blood history, that needs that blood.
Now, Derek, you started the foundation, the Sickle Cell Foundation, and you work with a lot of patients yourself. You want to talk about, what you are dealing with, because you actually have children that have sickle cell also.
Yeah, that's correct. We have 2 boys with sickle cell disease. Thankfully, they are not transfusion dependent, although my youngest son had to do hip surgery for a complication of sickle cell avascular necrosis, and he had to get an infusion, a couple of infusions before and after the surgery. And so, but I know, yes, and a lot of patients who are transfusion dependent who require regular transfusions for a number of reasons. Some are to, reduce the risk of stroke, especially in the pediatric population. I mentioned the last time we were on, Dr. Paul, that, there's this test called a Transcranial Doppler that's done in very small children. And if the blood flow in the brain is indicating that they're at high risk for stroke, then they have to be on transfusions. And sometimes if they've had a stroke, they're on transfusions lifelong. And so that's something and then there are other patients who have several crises, and the only thing that helps them is a blood transfusion because, they're getting blood that has hemoglobin A, normal non-sickling blood cells, as opposed to the sickling blood cells. And so that makes them feel better. It doesn't last forever, but it certainly is a known therapy. So it's a critical need for the sickle cell population.
Now, I know we have James. Can you hear me, James?
Yes, sir.
Okay, thank you for coming on. Now, James, I really want you to tell your story because it means a lot that you're able to be with us and you're still here with us and you're still fighting to be here with us. So please tell your story, James.
Where do you want me to start off my story, as in how do you want me to start off?
Well, we have the story of you because you get transfusions now. And when did you find out and how and when you recognized that you were sick? I think James froze a little bit. So how long have you known James, Derek?
I've known James for about 6-7 years, maybe.
Hello?
Yeah.
Okay.
Oh, you're back, James.
You're back.
Hello? Can you hear me?
We can hear you now.
Yeah.
Yeah, my phone had my outside had to come out front because my the service is where I'm at is kind of bad. But can you hear me though?
Yes, sir. Go ahead.
You might need to turn your video off so that you don't have a delay.
We can hear you. We can hear you.
James, if you can hear us, you might want to the other thing you can do, James, is just call in. If you have the call-in number, then you can just call in and talk, and then the video won't interrupt. Yeah.
So you were saying you guys.
Yeah, so I'll let James talk. James, has become much more active as an advocate. He actually, approached us and said, he really wants to get more involved, and he has been very helpful in talking to young folks just about, sickle cell and He has a story that I would really want him to tell himself, because I think one of the things with blood transfusions, it's one thing to get the blood, but it's not an uncomplicated therapy, right? So you don't just get the blood and walk away. So the more times, for example, one of the most common side effects of that is what we call iron overload, because as you get more blood, you're building up iron, and you constantly have to be taking that iron out. And so, James, can you hear us? Are you back?
I'm back. I apologize. I'm back. I'm fully back.
So yeah, I was just telling them, James, that when we met, that you've wanted to really tell your story and just become more of an advocate. And nobody can tell their personal story like themselves. So I was just saying that blood transfusions, it's one thing to get the blood, but it's not without complications. It's not just an easy therapy that you just walk in and walk out. So maybe you could just say how you started taking, having to use transfusions as a therapy, because they're,
Okay, so as I learned that since I was 3 weeks years old, that I was getting regular transfusions, so to help me, stay out of a crisis. So by then, as I got older, it got weird though that I learned that once you keep getting regular transfusions, you pick up a line of iron, other people iron and stuff like that. So iron is kind of like bad for sickle cell patients because of the liver. If you get iron overload, then you'll get damage to the liver. So by me learning that, they took me off of the simple transfusion and put me on the apheresis. So what I will say is that as I'm getting my apheresis, it do help me stay out the hospital. So I encourage that more people do help out with, more African Americans do help out with giving blood, and just taking the time out just to help other people, even if it's just not African Americans, just other people dealing with the disease that we have. So my thing is that as I've been getting my transfusions, I had it's also a mind thing too, because it's like, since I had got a transfusion, I had an allergic reaction. I had probably like 2 allergic reactions, and my second allergic reaction that I had from a transfusion was Hep C. But I cured that, I came out good with that. But then, so now that I'm still getting my apheresis, it's kind of like a mind thing. But I also know that it's actually helping saving my life, the apheresis, and it's actually helping me to stay focused on what I need to stay focused on as far as living my life. So I do want to, say that within me catching what I caught. But I kind of, like, Mr. Dirk helped me a lot, with me talking to him and understanding where I'm coming from and stuff like that, because he had 2 sons, like he said, with sickle cells. So I kind of feel as though that, I just wanted to let people know that it is ups and downs with the transfusions, but I just think it's more so mentally than physically, because physically, when we come out of the transfusion, we actually feel better. For me, it actually take like 3 days for the blood to actually work for me. But for some other patients, it take right away. They feel better right after that, I heard. So, but I just wanted just to, come on and just explain that for the transfusions, that I still want to continue on getting my apheresis though, because I know that regardless, it's just up to God's hand. It's all in God's plan. So whatever I'm going through. So I just wanted to say that.
Miyoshi, you want to ask him anything?
I guess, have you ever found yourself in a situation where there was no blood available and your treatment was delayed?
Yes, ma'am. Yes, ma'am. And that actually sent me into the ultimate crisis, where I had acute chest syndrome, and with acute chest syndrome, that just feels like something like a heart attack or something like that, or you get fevers, it's just real bad, where your body lock up on you, stuff like that. But then once I actually got my transfusion, it actually helped me. So yes, I did. I had a couple delays, and it's kind of disappointing because it feels though that people do try to help, but I learned that it's more so Caucasian people that give away blood than African Americans, and it's kind of like hurtful for real, because if people like have people that's going through something, as far as African Americans, we all go through things regardless. And I just feel as though that we just need to be more with each other to help each other out, because we all we got actually. So I was told that if it was more people actually donating blood, then I would have been in that situation. So yes.
That is so true, James. Thank you for sharing that. And, I mean, I'm trying not to tear up because it hurts so bad when I go out into the community and I'm trying to express and explain and educate why there's such an important need for more Black folks, African American folks to donate blood, because even though we have more blood donors that fall in the Caucasian group, even then it's only 3% of the total population that's donating blood. And out of that 3%, 1% of those donors are Caucasian. So that makes up like 80% of our donor pool. However, they're not the only ones in need of blood. So we just want as an organization, as the American Red Cross, to help usher in a culture shift. Our goal is to hopefully drive into the community why this isn't just about, well, it's not hurting me, I don't have a family member. Well, we're all in this together, because nobody ever plans on needing blood, and nobody knows when a family member is going to need blood. But most importantly, like you said, James, it's just to help other people. Not only are you giving back to the community, but you play a very special role in the ability to help this very unique group of patients that's going to rely on transfusions probably longer than a cancer patient or that patient that's coming in to get a kidney transplant. Those are procedural related, whereas we know blood transfusions, that's not the cure or that's not the answer, but it's an option for treatment. And it's one of the most readily available treatments when you're talking about things like drug therapy and crisis, because I know sickle cell patients that they're so distraught and traumatized by the way the medical community receives them as just, oh, how are you in pain again? They question their pain threshold, and it keeps people from staying on track with treatment, because now they've got to justify why they need this relief immediately. And I think that's why it needs to be a culture shift. Healthcare professionals need to do a better job. Black, brown, Americans, the whole entire community needs to do a better job, and everybody needs to pay it forward. And I'm a firm believer in that. So I want you to know I'm out here fighting. I'm grateful to be in the presence of individuals like Mr. Derrickson, Mr. Robertson, what he's doing, and Dr. Dyer, what they're doing, trying to use their voice to make sure we all play a role in this culture shift. So we got your back, James. And I'm so grateful that you're here with us today to share this.
I appreciate that, and I'm happy for everything you're doing. I was told a little something about you, so I'm happy for what you've done too. So I appreciate that. We need more people like you. Like we all in, like you say, we all in it together, and it's like I actually understand that now. Like at first, I just, like you say, some people, I wasn't on track for my healthcare. I wasn't, because it was like, why go to the hospital if I'm gonna get treated like that? So I definitely understand. But as if we gotta live, we all gotta do it together. So I get it. I appreciate your help too.
And I just want to say with the Red Cross, I think one of the things that's important and Dr. Paul, I really thank you for giving James, a voice, because messaging is important. And I think a lot of times the reality is when you see people looking for blood, we don't see people who look like us.
No.
It may be a cancer patient, and we empathize, and those folks need blood too. I mean, it's important, but we don't see us, and we don't hear from us. I know the Red Cross has I just came across some really nice videos that they have of a sickle cell patient actually going to somebody who was actually donating, and also I think the Red Cross organizing things like that and putting a face behind, and it's more than just hearing the word sickle cell, because when they see James or they see my sons or they see the thousands of others, it's much more personal and much more powerful. And then the other piece of it too is, we haven't even talked about James is studying to become a community health worker, right? I know a young lady who is on transfusion dependent, and she just finished her master's in social work. And so these warriors are living their lives, and they're living their lives getting the blood. So we need to have those stories out there, so it's not as though James, he gets his transfusion and goes home and sleeps and doesn't, he's working and he's living his life, and making a difference. He participated last week when we had our Annapolis Day. So he talking to legislators, his state senator, and doing stuff, and that's what these warriors do, and so it's important that folks really hear that, and using the large platform that the American Red Cross has, and platforms like this one with Dr. Paul, I just think it's so important, so it's really important.
James, you said something that and Miosha's right. It's hard not to feel like I want to cry, but when Black people in the community, African Americans in the community, people of dark melanin skin cannot help each other in this simple format, it makes me sick. It is so difficult to wrap my head around. Really, you're not going to give why? And whatever reasons of the dot 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 blows me away, because to me it cannot be information and it cannot be education. It literally has to, you literally have made a choice not to save a life. There is no other way around it. For you not to give blood, you're saying I don't care about my fellow community living partners. And when you ask someone directly, they're very defensive. But when we do things like this and they're able to hear it, they're able to hear your voice, James, and maybe, just maybe, and this is how sick and sad it is, we literally have to put a face to the disease before they have to donate. That's disgusting. Why does someone...
That's why it's a culture shift.
Yeah.
It's going to be a process, and there's a lot of historical trauma that's contributed to our hesitancy to do these kind of things. And we understand that. And we just want to use every platform we can to educate the community, inspire these folks that haven't really thought about donating, because maybe they haven't really thought about it to the degree of where we need them thinking about it. So partnerships are crucial, and that's why we're working with organizations like the 100 Black Men and the Maryland Sickle Cell Disease Association, and our faith-based community partners like St. John Baptist Church, which is hosting the first blood drive behind this initiative on April 9th. So I think the more we bring these opportunities to the community, the more likely we are to see more people saying, okay, well, let me give this a try. Let me see, my pastor's encouraging me, my church family is encouraging me, and people that I look up to are encouraging me. But as an organization, as large as we are, we cannot do it alone. We are counting on the Black and African-American leaders of the community to help leverage their platforms so that we can really communicate and amplify the need, because this is not going anywhere. So we need to do what we can right now. Like you said, Dr. Paul, it's less than an hour of your time, and nobody loves needles. Tell that 5 or 6 year old child that you're afraid of needles that's going into the hospital to deal with multiple needles. It seems kind of ridiculous when you compare those two.
Yeah,
but we get it.
You touched on, I'll just give a quick anecdote. When my son was about 8, 7, 6, maybe younger, maybe 5 or 6, and they were getting ready to put his IV in, and the nurse was calling like 4 different nurses because they were all ready to have to hold him to do this thing. And we just looked at them like, what are you doing? This is like his 10,000th needle stick. It's like he couldn't care less. He just put his hand out and got his IV, end of story. But I was going to ask him, does the Red Cross have a video on like what happens to the blood from when it leaves that bag, and it where does it go? Because I think that's something, I know folks have asked me that there's something about your blood, it's like you're taking, whether it's just anecdotally or just in language, it's like I give my blood, sweat, and tears, so it's like your blood, it's like, and so it's like you see this bag of blood there. What happens to it? How does it end up with James?
That's right.
Getting a life-saving transfusion.
That's a great question, and a great point. And to answer your question, we do. We have a really quick and user-friendly, just super easy to understand video that really talks about from donation to transfusion. So you get to see the entire process from the moment that blood is drawn. It's tagged with very unique information attached to the donor. And so if folks have access to download the app, they get told every step of the way from the moment that blood was processed to the down to which hospital is transfusing that unit right there in real time. But if they don't have an app, that's fine, as long as they have an email. We share the blood journey with the donor. We weren't able to do that a few years ago, but now I'm excited to say we have leveraged technology that we can not only tell that donor from blood draw to blood transfusion where it's going, but we do have a great video, I think, to your point, Mr. Robertson, that this could also be helpful because people are like, yeah, you're taking my blood, but where is it really going? I can assure folks out there, we're not in the business of cloning and just taking blood and selling it on the black market. And you'd be surprised at some of the myths and just conspiracy theories, but I'm here to tell you, we are neutral, we are independent. Our job is to make sure the blood is available, and we can assure you it is not being wasted.
Yeah, I'm not a plug for American Red Cross, but I've been in the blood business for a long time. And I believe American Red Cross, I don't know if you're the only group, but I know if not only one of you that actually does not pay for blood to be collected. It's all volunteers.
It is all volunteers.
So there are lots of other blood collection options, and sometimes college students and others and will get paid to donate their blood. And I'm not doing a philosophical difference, but it is a difference to say that every unit of blood that the Red Cross collects, it's a volunteer effort, and that means that I think that adds something to it. I mean I don't fault anybody for selling their pint of blood or whatever, because everybody has different circumstances, but I think that's important.
James, before we take off, before we let you go, is there anything you want to tell your students, your people, all of us, how and what they need to do to help others just like you?
To be honest, yes, that's like not a hard question, but it's like coming from the heart. I just really just want people just to really try to put yourself in somebody else's shoes. Like if you depending on this, say like the blood, I gotta depend on that to actually go on with my life. Like that's one thing that actually helped me as far as having sickle cell. That actually helps me. So if it's somebody, I try to explain to my family and too, y'all gotta donate your blood, because if you don't, then it's gonna be people out here that's really dependent on that blood that might die. That's just something. If you want to take yourself out of yourself and just really look at it, try to be a mirror or something, somebody telling you. It's kind of, I don't want to be all over the place, but I just really just want people just to actually give some type of sympathy for people that's actually going through something in life that actually you can actually help. And it's just like what kind of get to me is everybody do so much. Don't get me wrong. I got people that die from cancer and stuff like that. Don't get me wrong, but it's just like people do so much for cancer, and it's just be like, what about us? What about the sickle cell patients? So I honestly feel like if we all come together more, then it'd be bigger than what it really is. Like people I don't want to pronounce her name or something, but she just was speaking on how she got to go and educate people and tell them our side of the story. I believe if we have more things like this, what you're doing and what y'all doing, I really believe people will listen and then put a face to it and actually feel where that person coming from.
Now, I think I'm going to ask you the question. This is a direct question, and it's very direct. Do you think the reason why the many don't care is because we're black with this disease? You think it's a black issue, then also a sickness? Do you think even blacks don't put their lives and other lives as purposeful?
Yes.
That's That
Yes,
hurts.
it's plain saint because we get treated like we drug seekers in the emergency room in the hospital. So I know it's a black thing, and I done seen an actual drug addict come into the emergency room and get treated like he was just a regular person. It was a white person. I actually been treated like that. A doctor will come in my room and tell me all types of stuff. If you're in pain, you shouldn't be asleep. So it's actually is a black thing. So it's like it's just people just got to be more educated with it. And I don't want to be politically correct, but I know it's a black thing, and I just want it to stop. Actually, like that's why I try to do what I do to try to help the people behind me, like the kids that's coming up behind me with this disease. So just people just I don't know. You got people in your own family members that don't care.
Yeah, and you know what, Dr. Paul, there was a study done by another sickle cell warrior. His name is Carlton Haywood. He's a PhD bioethicist, and his studies showed that not only is it a racial issue, but when he controlled for race, there was still disparate treatment for sickle cell patients. There was something about how the sickle cell patient was being treated that went beyond race. It was just almost as though they just refused to believe that these folks could be in the pain that they're in. They refused to believe that they could be having the complications that they're having. And so that was with race control. So you have like a double whammy with sickle cell disease. We all know the black thing. I mean, if anybody didn't know before COVID, they have no excuse now, right? So we all know the disparities for black people. And it's not just healthcare, right? It's education, it's policing, it's you name it, right? But when you even add that to just work, having to live with this disorder, it's a challenge.
Miosha, you okay?
I am. This is great. I'm really appreciating this conversation, and I feel so privileged to have opportunity to chat with James because again, my mission is to help usher in that culture shift, and I am not playing devil's advocate, but it's one of those things where you understand why we are where we are as a Black community, and like I said, there's a lot of historical trauma, but there's no excuse today. There's enough access to information where we can do better. And I believe when you know better, you do better. So yes, I'm committed to pounding the pavement and harassing folks that consider themselves community leaders and supporters of the Black community. If you can't get behind this initiative, then I have to wonder what I'm not sure.
I'm gonna volunteer James, and I'm gonna volunteer others. If you need a voice, a patient voice, I mentioned this before to you on the phone. These guys are gonna step up, and they'll if you ever need James, and I won't say her name, but there are others out there who I know I can just call and say, we need you to tell your story to this group.
Yes.
And they're there. They're ready.
That's good.
Yeah.
I appreciate that because I'll take you up on that.
Me too.
James, I'll be calling.
Yeah,
I hope so. Honestly, I'm here.
Here's the thing. We have talked for decades about Black on Black crime. We've talked about it for decades. This is a specific Black on Black crime that we can actually fix.
Oh, that's deep.
Dr. Dyer.
That hit home.
You're taking it to a whole nother level. I mean, I understand what you're saying about the Black on Black, but and I think it's important to preface that with the fact, for those that don't know, the sickle gene, the mutation, if you will, this goes all the way back thousands of years to Africa when it was first discovered about 5,000 years ago. And then it showed up again 3,000 years ago in India. And so again, this mutation is protection in malaria-ridden zones. And that's why you get that cell in the
Mhm.
first place. And so many of us that are descendants of Africa, we still carry that history in our blood. And a lot of us don't know that. So I think I personally cannot like say it's a black on black crime, but what I can say is when you know better, you do better.
Right.
I have faith in the Black community, because if we can't step up and protect and uplift our own community, we really can't expect somebody to take the lead on that. And so it's going to take some effort, and it's going to take leaders like you all on this call to just stay at it, and we won't let up. We're committed.
Yeah.
Here we're not giving up.
No.
And the reason why I wanted James to come on and you could hear it for yourself, James will always talk from the heart. James is not going to, he's going to tell his truth, and I've seen the difference. He gave a talk once to some nurses at University of Maryland, and that had a huge impact just in terms of how they were going to treat patients, so sometimes you just need somebody who's just going to tell their truth, just tell their truth.
It's true. I think telling that truth is imperative, and getting healthcare providers outside of that setting so that they can hear it from a patient when they're not in a crisis is important, because the disparities are not just with the lack of Black and African American and Latino blood donors, but there's issues within the healthcare arena that we as an organ, that's beyond us, but we want to make sure the blood is there.
Right.
But I know that these conversations are taking place across the spectrum. I've participated in several health fairs and forums where sickle cell disease is always a topic when we're talking about disparities in the Black community. And so in order to really address that, you're going to have to, kind of take it step by step, and it's going to involve, that outreach part and that educating folks. Otherwise, they really won't know, and they won't feel compelled to contribute to the community in this kind of way. But it starts with us. I can't go to one of my brown or Caucasian brothers or sisters for this need, because there's only so much of those properties they have.
Right.
And that's where those allergic reactions in your body builds up antibodies against certain blood donors after a while. So we have to do what's right, because we're part of this population, and we want our communities to thrive. We want members of the community like James to have a high quality of life, because it's possible
To him to
for
live.
us to do the most we can, which is, we're not asking you. I can't even imagine having a conversation behind some other, things where people are waiting on organs and other transplants. We're asking for blood.
Right.
Something that your body plenty out, and it's only going to take less than an hour of a person's time to make a huge impact on a person's life.
Now, for those of you who listen out of state, in state, and around the world, you can find a place where you can donate your blood. You can contact the local American Red Cross and find out where a donation station is. It is that easy. If you can call for pizza and Domino's, you can call and find out where the damn blood drive is and go donate. So don't give me, I never knew where it was. That is, I literally don't know where Domino is. But if I pick up my phone and say, Siri, find me Domino's, it'd be like, blah, blah, blah. You could do that with donating blood. It is really that simple. James, will give you the last word before we take out of here.
Yeah, I want to back off of that, like piggyback off of what you just said. Yes, I just want people to just more donate, because it's actually saving lives out here. So just donate more and just have a heart. Like, everybody got a heart. You got to feel some type of sympathy for somebody. So just have a heart. That's it. People really trying to live their life out here, and it's really just our sickness that's just stopping us. So just have a heart. That's all I can say.
James, we'll talk more off air, but I'll let everybody know. Thank you for listening to Bridges Live with Dr. Paul, and we'll continue to have more shows about sickle cell. We'll continue to have people on like James and Derek and Miosha, because we're passionate about getting the information, the education, and the understanding out there so you can put yourself into an action to do. That's it. We give you the information. You understand the information. Now it's time for you to act upon it. Thank you, and everybody, God bless. And you guys stay on. I'll talk to you guys later. And everyone have a great evening.